Chapter 4: Causes of Cancer. In this lesson, we'll explore a wide range of internal and external factors that contribute to cancer development. From lifestyle choices to genetic aging, from chemical exposure to viral infections, cancer arises through complex interactions over time. Understanding these causes helps us prevent cancer and develop more effective treatments. Let's begin by examining how scientists study what actually causes cancer. To identify carcinogens, scientists often use animal models. Rodents are exposed to chemicals under controlled conditions, sometimes at high doses, to observe cancer formation. Although animal testing has limitations, it remains a powerful tool for identifying dangerous substances. The Ames test is another key method. It uses bacteria engineered to detect DNA mutations. A positive Ames test suggests that a chemical is likely to be a mutagen and possibly a carcinogen in humans. Cancer is extremely rare in children, but becomes more common as we age. One major factor is immunosenescence, the gradual weakening of the immune system. As we grow older, our cells accumulate mutations and lose the ability to detect and destroy abnormal cells. This makes older adults significantly more susceptible to cancer. Aging itself is therefore one of the most powerful and non-modifiable risk factors. Where you live has a major impact on your cancer risk. Environmental exposures, diet, and lifestyle patterns vary widely by region. Migrant studies show that cancer risks shift when individuals move to new countries. For example, Japanese immigrants in the United States experience higher colon cancer rates compared to those who remain in Japan. This reveals that local habits and exposures can override genetic predisposition. Tobacco is the single most preventable cause of cancer worldwide. Cigarette smoke contains over 40 known carcinogens, which damage DNA and promote tumor growth. Smoking is responsible for lung, throat, pancreatic, bladder, and oral cancers. Even non-smokers are affected through secondhand smoke exposure. The link between tobacco and cancer is one of the most well-established in medicine. The risk of developing cancer from tobacco is dose-dependent. This means that the more someone smokes, the greater their risk becomes. The number of cigarettes, duration of smoking, and how deeply the smoke is inhaled all contribute to increased cancer likelihood. There is also a time lag of around 20 years between peak smoking rates and cancer incidence. This delay explains why cancer rates may rise even after smoking declines. Alcohol is another major contributor to cancer development. It damages cell structures and contributes to chronic inflammation, particularly in the liver. Alcohol use is linked to liver, esophageal, breast, and colorectal cancers. When combined with tobacco, the risk multiplies dramatically by as much as 38 times. This synergy shows how multiple carcinogens can interact to amplify cancer risk. The food we eat plays a large role in cancer prevention or progression. High-fat, high-meat diets have been associated with an increased risk of colon cancer. Certain cooking methods, like grilling at high temperatures, can produce carcinogenic compounds known as PAHs. Studies estimate that 30% of fatal cancers are linked to dietary patterns. Eating a balanced, plant-based diet can significantly reduce cancer risk. Some natural and synthetic substances in food can act as carcinogens. Aflatoxins, produced by mold in nuts and grains, are potent liver carcinogens. On the other hand, anticarcinogens, such as lycopene and resveratrol, can help neutralize harmful agents. Processed foods often contain nitrates and nitrites, which may also increase cancer risk. It's not just what we eat, but how our food is grown, stored, and prepared that matters. Radiation, both natural and man-made, is a known cause of cancer. Ultraviolet radiation from the sun is the leading cause of skin cancers, including melanoma. Ionizing radiation from X-rays and nuclear sources damages DNA and can lead to various cancers. Radon gas and radioactive polonium are naturally occurring but can accumulate in homes and increase lung cancer risk. Protective measures and proper regulation can help reduce exposure. Infections can also trigger cancer by altering cell function or promoting chronic inflammation. Epstein-Barr virus, or EBV, is associated with Burkitt's lymphoma. Human papillomavirus, or HPV, causes cervical and throat cancers. Hepatitis B and C viruses damage the liver and can lead to hepatocellular carcinoma. Vaccination and early treatment of these infections are powerful tools in cancer prevention. Cancer results from a combination of genetic, environmental, and behavioral factors. Major risks include tobacco use, alcohol consumption, poor diet, radiation exposure, chronic infections, and aging. Fortunately, many of these risks can be controlled or minimized. Public education, screening, and vaccination programs are vital components of cancer prevention. Awareness is the first step toward reducing cancer's impact on our lives. The Ames test is a laboratory technique used to assess whether a chemical can cause genetic mutations. Bacteria that cannot produce the amino acid histidine are used in the test. When exposed to a mutagenic chemical, some bacteria undergo mutations that restore their ability to grow. This indicates that the chemical is likely a mutagen and possibly a carcinogen. The Ames test is widely used for screening drugs, food additives, and environmental toxins. Secondhand smoke doesn't just contain toxins, it also promotes tumor growth indirectly. It increases the expression of VEGF, or vascular endothelial growth factor. VEGF stimulates the formation of blood vessels, which feed growing tumors. This angiogenic effect may explain how even non-smokers are affected by smoke exposure. Limiting secondhand smoke protects not just lungs, but overall cellular health. When carcinogens are combined, their effects are often worse than when acting alone. A classic example is alcohol and tobacco use. Each one increases cancer risk independently, but together they magnify it significantly. This is due to their combined effects on tissue damage, inflammation, and DNA mutation. Understanding these interactions is critical for shaping public health strategies.